Today we will review ICD10 CM coding guidelines for orthopedics. We will also review common orthopedic disorders and compare ICD-9 CM codes to ICD-10 CM codes, guide you through additional documentation requirements, code case studies, and provide you with coding tips and hints to make your transition smoother. Let's get started. Chapter 13 of the tabular list in ICD-10 includes diseases of the musculoskeletal system and connective tissue with code range M00 to M99. A note in the tabular list directs you to assign an additional code for the external cause of the condition. You'll code here numerous orthopedic conditions, including arthropathies, osteoarthritis, and joint disorders. Body site options for codes include bone, joint, muscle, and multiple sites, or unspecified sites. Assign more than one code if a multiple site code isn't available, but more than one bone, joint, or muscle is involved. Specifying whether the condition occurs on the left or right side or is bilateral. Assign a code for an unspecified side as a last resort. And that will be a theme that we see throughout ICD-10, is that hopefully our doctors are providing the specific information that we need to choose a specific code, since that's the intent of ICD-10, and supports the clinical record. The rumor is that insurers may not cover the unspecified sides, expecting to see the more specific code information used. For certain conditions, the bone may be affected at the upper or lower end. In this case, you'll code as the bone, not the joint. Conditions affecting the musculoskeletal system may fall in one of three categories: acute with a sudden onset, subacute, which is a condition falling between acute and chronic, chronic, which is defined as going on for 3 months or more, or recurrent, a condition that occurs more than once, often the result of a healed injury. You may see these terms in the ICD-10 index as non-essential modifiers following the main term. For example, when you search for arthritis in the index, you will find non-essential modifiers acute, chronic, and subacute, along with code M1990. When you cross-reference M1990 to the tabular, the code descriptor states unspecified osteoarthritis, unspecified site. You need to go to then look and find the more specific type of arthritis in order to assign the specific code. Osteoporosis is a systemic condition, meaning that it affects all of the bones in the body. When coding osteoporosis, identify if there is a current pathological fracture or history of a pathological fracture. Assign a code from category M81 if the patient has a history of osteoporosis with a pathological fracture. Assign the history code second, which would be a Z code, such as Z87310, which is for personal history of healed osteoporosis fracture. Category M80 is for patients who have a current pathologic fracture at the time of encounter. Additional characters under category M80 identify the site of the fracture. Remember that an osteoporosis-related fracture is one in which the bone fracture occurs in a minor fall or trauma where it wouldn't normally occur if the bone was healthy and normal.